Hello, my name is Pooja and I have completed my master's in medical microbiology, and from the past 1.5 years I have been associated with medical research as well as academic writing and supporting students overseas in designing their assignments to fetch HD grades. So in the world of nursing, health promotion plan is a very important topic, and today we'll be discussing about the importance and the benefits of health promotion plan for managing chronic illnesses. So, firstly, we'll be discussing what does health promotion means. As discussed by the World Health Organization, health promotion enables people to increase access over their health, which means they will be provided with the resources so that they can improve their health not only by just minimizing the risk of the disease or the illness, as well as promoting health in a very beneficial way. Health promotion programs aims to engage and empower individuals and communities to choose healthy behavior and shift their behavior towards social and environmental interventions so that the risk of developing chronic illnesses will be reduced. So in this very particular presentation, the health promotion plan will be focusing on COPD. COPD means chronic obstructive lung disease, which is basically a respiratory illness which involves the obstruction of lung airfolds and affects the normal breathing pattern. In 2017-2018, the COPD was the fifth leading cause of death in Australia, and the prevalence rate was more than 7.5%. So that's why there is a need to design a health promotion plan for supporting the people or the patients which have been affected with COPD. So the other common symptoms include cough, dyspnea, sputum production, and other symptoms, and they become only evident when the lungs are damaged and the disease becomes irreversible. So it's a very interesting thing to generate or to design a COPD health promotion plan in this manner, because the common symptoms which a human being found is only after the infection has been established. So there is a need to aware people about COPD and provide resources like health promotion plans so that people can enhance the access towards their health. So it is also known that cigarette or tobacco smoking is the most documented risk factor for COPD, and therefore it can be designed as the basis for a health promotion plan to design better programs. So the other risk factors including malnutrition and lack of physical activity. These two are other risk factors which are contributing towards COPD, but at the same time these are preventable risk factors. So preventable risk factors are such factors which are prevented by intervening at a specific and at a certain time so that the illness can be cured or the risk of infection can be minimized. So the health promotion plan goals for this very particular COPD will involve three major things. First, to reduce the tobacco and smoking consumption by the population or by the patient population. The next goal will be to increase the physical activity. And the third goal will be to increase the consumption of a healthy and balanced diet to dissolve malnutrition. So in this case, all the three goals of this plan are focusing on preventable risk factors which can be intervened and the patient can be benefited. So the health promotion plan will work in partnership with the communities, government and other external stakeholders, and they can join and coordinate together to design best health promotion plans for the safety of the people. The medical advisory secretariat can also be involved because it will form a cost-effective healthcare service plan promoting health equality by increasing access to effective healthcare services. So for any health promotion plan, we need to design a health logo. So in this case, the health logo will be focusing on living well, which describes quit smoking can heal the patients and help to live a healthy life. So the motto will be enabling the people to quit smoking so that they can receive a healthy life. This guidance will help COPD patients to take effective health solutions for improving their lives. Locking down bush nursing services and co-op community health services will coordinate. Particularly, these are few examples of few communities which can coordinate together and design effective health plans. Creating programs will generate a safe and healthy life for people living with COPD. It is an effective way to improve health outcomes. Reducing the smoking and tobacco practice among adults will help to promote the health, as well as where the communities and the health services will coordinate and improve healthcare access. So the first goal, as we discussed in the previous slide, will be based on tobacco and alcohol. So this goal will focus on providing ways or interventions so that the people can reduce the amount of tobacco and alcohol consumption, because these two are the basic risk factors contributing to COPD. The important approach in this program will minimize the smoking habit, protect adults from passive smoking, and help to quit as well. By partnering with state and local authorities to minimize the existing risk factor for COPD and including limiting the influence of tobacco industries in the province to keep the adults away from the substance abuse, which means they will create such ways so that the young people as well as the people who are smoking at an increased or excessive rate will receive benefit and will receive ways so that they can limit this tobacco consumption. Moreover, they can also include media systems to protect the youth from substance abuse. The second goal is based on physical activity, which means if the program will create design so that the physical activity can be increased, because increasing physical activity is a means by which we can increase the health of our respiratory lungs so that the people will receive benefit, and at the same time the risk factors will be minimized, which are also avoidable. So the main focus on creating a prevention and education infrastructure that will focus on increasing the spaces where an individual can remain active. So these will provide spaces like parks or exercise by coordinating with any physiotherapists so that the exercise plans can be generated and the people will receive benefit. People will remain active by just walking in the social parks. As I just said, parks can be designed. People can go to market and offices. So walking and doing exercise is a priority for all the COPD patients as well as the normal human beings to avoid the risk of developing COPD. In this case, the sport events like marathons can also be created by the regional Victorian government. Will encourage the adult to participate even for keeping their respiratory muscles active. This is exercise is a better way to create and maintain respiratory muscles which are involved directly in COPD prevalence. This will eventually increase the access of people towards transforming a healthy life and environment. So the basic focus of this goal is to increase the access of a healthy life as well as a healthy environment. We can conclude by this paragraph. And the coordinated care organizations will also support the change in policy systems. There will be tons of policies which are already existing and supporting to reduce the risk of COPD. But then with the current scenario and with the changing healthcare systems, certain changes can be made in the existing policy systems where exercise can be included as a goal to reduce the risk factor and improving the health of respiratory muscles. So the coordinated care organizations can coordinate well as communicate and generate healthy environment for the patients. Moving towards the third and the last goal, which is based on nutrition. So increasing the health, increasing the health by means of nutrition is a very basic way so that better health outcomes can be achieved. The improper diet is directly increasing the health burden on the population. It is a well-known fact that if we will not eat properly and not in a balanced diet, the risk of other diseases or illnesses will be increased twofold. If we consider an individual, two individuals, the one who is having a balanced diet and the other who is not, so we can see that the person who is not having a balanced diet is at more risk of developing infections, the common flu and other respiratory infections, while if we'll see a person who is having a balanced diet will not be at increased risk of developing infections like flu. So healthy nutrition and balanced diet is a goal so that the risk of COPD can be managed. The program will partner with the Victorian authorities and the community stakeholders to create the environment to increase the availability of healthy food. The main factor which the most of the people experience is the availability of healthy food, because most of the people, especially in the low economic areas, are not provided with healthy food, and they are not provided with resources so that they can get the healthy food of their own choice. So to increase the availability of healthy food is a part of this goal, which need to be implemented so that healthy outcomes can be achieved. The global burden of disease study has concluded that the food chronic combinations have been identified to the leading cause of COPD and revealed that the 8 diet elements. So this needs to be considered very importantly. The 8 diets which can be included in a healthy diet will include grains, nuts, seeds, milk, juice, processed meat, and non-starch products. As this is shown by the evidence that these all foodstuff can design a healthy meal for the COPD patients. The local community groups can use newspapers and mostly read by the target groups to increase the use of 8 elements. So now if we have discussed that these 8 items must be consumed by the patient population, but the people living in the low economic area will not be aware about this thing. So increasing the awareness about these food products is important so that the people will be aware that these are the food products that we need to consume, particularly to avoid the risk of COPD. So for this reason, the local community groups will use the newspapers, and these are mostly read by the target groups, and to increase the use of these 8 elements. And moreover, to increase the adoption of nutritious regime by the target population will help the percentage of COPD, and the program approach involving media will require compatibility, less financial support. As we know that publishing any article in the newspaper is a cost-friendly manner, so that more and more awareness can be circulated to the patient population in a cost-effective manner. So now when we have designed the plan and when we have selected our goals, there should be a way so that we can evaluate the effectiveness of this plan. So for that reason, evaluation is must. So it is a way we can find out whether this plan is actually working and reaching out to the people who are at risk of developing COPD or not. So auditing and keeping a record on new cases. For example, in year 2017, if there is a prevalence of 5.7%, so we'll keep a track in the next year, like in 2018, what would be the risk, the prevalence rate of COPD. So by tracking this and keep on continuous auditing among the target population, we'll be able to achieve how much the population has gained the benefit from the plan. So this is a way. And many studies have argued and suggested that this program has, from the past 10 years, has been estimated that out of 29%, 12% developed COPD. So this is a very big achievement, that out of 29% population who are already at the risk of COPD, only 12% developed COPD. It means the plan is working in a good manner. Moreover, the existing screening and briefing interventions have been made. The early identification of the COPD patients, followed by explaining the benefits of limiting smoking and tobacco, has significantly reduced the binge smoking consumption by the individuals. So this awareness has informed people that they should smoke in a limited way, which has been established. The guidelines have been established how much to smoke in a day, and the awareness will help the people not to smoke in a binge manner. Therefore, the current health promotion plan, with advanced involvement of the local and state authorities, will improve the health behavior among the community. So, to proceed further with the evaluation, how much exercise goal has benefited the people? So, in the past few years, that have concluded that people who exercise show approximately 30% less incidence of COPD. So, this is a very big achievement as compared with the others who do not exercise. So the basic exercise for minimum of 30 minutes in a day will help the people to receive benefit and minimize the risk of COPD, which can be well explained by this statistical data. The recent audits explained that and that revealed that easy access to nutritional feed, even in the rural areas and increasing the nutritional literacy, will minimize the social and cultural perceptions of food. Because usually in the low economic areas, the people have a certain fixed plan of their healthy meals, but and they are not aware about the other meals because of their cultural perceptions. So creating awareness will also help the people to dissolve that perception and increase the resources of other healthy products. So at the last, to conclude this health promotion plan presentation, it can be seen that the health promotion program provides effective ways to manage the prevalence of COPD. This can be achieved by just preventing the risk factors which are 100% avoidable, like we see the one with the exercise, the one with reducing the tobacco, and the one while increasing the access to nutritious food. So the program approaches are based on reducing the risk factors and increasing the involvement of the state and local bodies. However, there is still an existing gap, and it is now for the government authorities to create strategies with an increased level of monitoring to manage chronic disease in the community. Still, the gap exists, and it is now the high time where government needs to intervene and increase the programs and increase the resources to the target population. The coordinated care strategies have called for a strategic plan along with the remote health policy organization for evaluating the existing COPD health policies and programs, focusing on improving nutrition, reducing smoking, tobacco, and increasing physical exercise for improving health behavior among the population. This can be well managed by increasing the levels of the stakeholders as well as increasing their contribution with the state and the local authorities, so that better health promotion plans can be made and the risk of developing COPD can be minimized. So this was all about health promotion plan. Have a nice day. Thank you.